One of the most difficult places to tone up on a woman's body is the arms, especially that underside of your underarm where saggy is not a good look. All winter long, we've been able to cover them in sweaters. Now it's time to get those triceps ready for tank tops. So Dr. Therese Stubbs is here to show us all the weapons in her arm arsenal at Therese Aesthetic Medicine. So welcome back, Dr. Ann.
Thanks for having me.
So why is it that that area is so tough to tone?
It's an area that tends to get lax skin or loose skin as we age, and it's an area that doesn't get a lot of workout as we, if we sit at a computer, if we are doing just a desk job, or even if we're driving a car, you don't get a whole lot of exercise in the arms. We walk every day, we tone our legs, we go up and down stairs, but the arms, unless they're addressed, they tend to get lax just with age.
And you have something called arm contouring. So what is that? How does it work?
Well, basically we use the Smart Lipo laser, and we can kind of address the fat that's underneath there, and then we can also heat the skin and cause some tightening with the laser. So it's basically a Smart Lipo procedure in the office, takes about an hour. We numb people up locally so they're not under general anesthesia. They're just basically under a little bit of local anesthetic on the back, one tiny little needle mark just right under the arm, and we can run the laser right along the back. It melts that fat, liquefies it, and then we suction that fat out with a just tiny little catheter, and we heat that skin so that it tightens up over the next few months.
So people don't have to worry about the fat being gone, but the skin still being there.
Exactly. The skin tightens because the laser heat builds collagen.
And is this considered, it doesn't sound very, I should say, but invasive?
Actually, it's under the skin, so it is minimally invasive, but you're not under general anesthetic. It's not as risky as a big arm procedure where you'd have a big incision. It's one tiny little needle hole. We've never had an infection in 7 years. Everybody seems to really love the procedure. It's a little bit of ouchy, soreness the next maybe week or so, and you wear a compression garment for about 2 weeks, which is just kind of a tight sleeve, almost just underneath your clothes, and it just helps that skin kind of mold right down over the muscle layer.
Let's look at some before and afters, and I want to talk about how soon these people are seeing these results, because they're awesome when you see them.
Yes, and this is a gal who just had a lot of excess skin and fat, and it was pretty much genetic. Her arms didn't match the rest of her body, is how she described it to me. She said, my Aunt Sally has these, my mother has these, so it's a hereditary thing where you deposit this fat. So we could suction some of that out, and you can see over the next, immediately she noticed a difference in the density of her arms, and then over the next few weeks to months, she gets more and more tightening of the skin there.
Okay, so the recovery could be a couple of weeks before they can take that garment off. Is that how it works?
Exactly. 2 weeks till the garment comes off, and basically that 2 weeks time, any bruising that's there, some of the fair people might get a little bit of bruising, but that goes away in the 2 week time, and then we can let them start exercising and doing everything they normally do after 2 weeks.
Okay, Dr. Ann, what about this example?
This one here, we did not only a little bit of Smart Lipo, which is melting the fat, as we talked about, we did some thermage on top as well, which thermage is a radio frequency and external heat to give more skin tightening. And some folks who are thin, they just don't like the texture of the skin on the arm. They have a little bit of just the laxity of skin. They feel like it hangs, and a crepey feel to the skin. So the thermage procedure puts deep heat superficially on top of the skin and basically creates that same collagen growth. So it's basically attacking it from underneath with the fat, and then again on top of the skin with the thermage. So it's kind of a 1-2 punch, and they work together very nicely to create some tightening on the thinner arms.
And how long are these results lasting?
They're permanent, because as adults we don't make new fat cells, so the fat removal is permanent. So basically the fat cells are gone, they can't expand and contract any longer. As far as the skin laxity, as we age, you're still going to get a little bit of lax skin, so we recommend after somebody has had the procedure to use a good Retin-A lotion or cream on the skin, because Retin-A works wonderfully on our face, but we forget that we can use it on our arms and our body too to create the collagen and the tightening.
All right, Dr. Ann, as always, you have a great offer for someone looking to get the Smart Lipo on their arms.
Yes, we are offering 20% off for spring to get people ready for summer.
And you always have free consultations. The best way to get started, of course, is to come in and talk to somebody who knows all about these options.
Exactly, and you'll see which one is the best for you, and we kind of can do a quick exam and see what the motives are, what the goals are, if there's a date in mind that we're aiming for, and put together a treatment plan.
All right, and you always have something to offer, so thank you so much, Dr. Ann.
Thanks for having me.